When you reach the age of 60, you can no longer ignore the health of this little gland because it is crucial to the male reproductive system. The secret to ensuring general well-being and quality of life is knowing how to keep your prostate healthy and being aware of any potential problems. A little gland in males called the prostate helps in the production of semen, which is the fluid that contains sperm. It is positioned in front of the rectum and immediately below the bladder. Men's prostates can begin to alter as they age, particularly after the age of 60. Benign prostatic hyperplasia, or BPH, is a disorder where the prostate gland grows larger. Urinating may be difficult as a result of this enlargement, along with other symptoms. Infections and, less frequently, prostate cancer are possible further alterations. As you age, it's crucial to monitor your prostate's health because these changes are frequent. This video will cover everything from screening to lifestyle modifications as we delve into useful tips and advice on preserving prostate health after 60. Common prostate issues after 60. Men may experience typical prostate issues as they age, especially after the age of 60, which can have an impact on their everyday lives and health. Benign prostatic hyperplasia, BPH, is one such disorder in which the prostate enlarges, causing difficulty urinating and frequent visits to the bathroom, particularly at night. Another dangerous illness is prostate cancer, which can pose major health hazards if not discovered in time, even if it does not exhibit any signs at first. Last but not least, discomfort, pain, and issues with urination can result from prostatitis, an inflammation of the prostate. Since each of these disorders has a unique set of symptoms and possible consequences, it is critical to remain informed and get frequent checkups in order to maintain prostate health. Screening and diagnosis. Maintaining prostate health requires routine screening, particularly for men over 60. Prostate-specific antigen levels in the blood are measured by the PSA test, which is an important screening technique. Another is the digital rectal examination, DRE, in which a physician feels the prostate to check for abnormalities. Early detection. These screens can help treat diseases like cancer more effectively. Men should typically begin these tests around age 50, but those who are at a higher risk might need to begin sooner. Depending on the preliminary results and the doctor's advice, the frequency of these tests may change. It's critical to comprehend the significance of the outcomes because elevated PSA levels or odd DRE findings can necessitate additional research. Are you struggling with prostate troubles and unsure of the best way to take action? Go into our latest video, Herbal Remedies versus Conventional Treatments for Prostate Issues, in which we compare traditional medical treatments to natural herbal remedies. Find out which option is best for you. Click the link in the description to learn more about the options and make an informed selection. Treatment options for BPH. Number 4. Lifestyle changes. For men over 60 with benign prostatic hyperplasia, BPH, who have no or mild symptoms, doctors may advise watchful waiting or monthly checkups without immediate treatment. Lifestyle changes are also indicated to help with BPH symptoms. These include reducing fluid intake, particularly before bedtime, limiting liquids like coffee and alcohol that cause you to urinate more, and avoiding medications that can aggravate urine retention, such as decongestants and antihistamines. Another effective strategy is double voiding, which is urinating once, waiting a few moments, and then urinating again to ensure that the bladder is completely empty. These strategies aim to alleviate symptoms and improve quality of life without requiring harsh therapy. Number 3. Medications. Men with BPH frequently use drugs as their primary treatment choice. There are several medications available, including alpha blockers, which relax the muscles in the bladder and urethra to enhance urine flow, and 5-alpha reductase inhibitors, which target hormones to halt prostate growth and possibly shrink it. Phosphodiesterase inhibitors are another alternative that relaxes muscles in the urinary system to improve flow. If urinary symptoms persist without increased urine retention, anticholinergics may be used to relax bladder muscles. Doctors frequently recommend a mix of these medications to properly manage the illness, with each prescription targeting a different component of BPH symptoms and causes to bring relief. Number 2. Surgery. When drugs and lifestyle changes fail to alleviate BPH symptoms, surgery may become necessary. It is especially recommended for men with BPH who have recurrent urinary problems, such as infections, blood in their urine, bladder stones, kidney difficulties, or an abrupt inability to urinate. Surgical approaches mostly attempt to reduce prostate size through transurethral procedures, which means the surgery is performed through the urethra. Transurethral resection of the prostate, TURP, is a common surgical therapy in which prostate tissue is removed through an electrically charged loop of wire, generally needing only a short hospital stay. Transurethral incision of the prostate, TUEP, involves making small cuts to increase urine flow, which usually allows patients to return home the same day. Simple prostatectomy is a more intrusive approach that removes extra tissue via abdominal or perineal incisions, requires a longer hospital stay and recuperation period, and occasionally uses robotic help for precision. These surgical treatments are chosen based on the individual's symptoms, overall health, and unique BPH issues. Number 1. Minimal invasive treatments. Minimally invasive treatments for BPH, such as laser procedures, provide alternatives to standard surgical methods that may result in faster recovery times and fewer complications. Techniques such as holmium laser enucleation of the prostate, HOLEP, remove blocking prostate tissue with laser accuracy, allowing patients to leave the hospital the same or next day, and giving long-term results that reduce the need for subsequent operations. Photovaporization of the prostate, PVP, uses a green light laser to efficiently evaporate superfluous tissue, usually in an outpatient environment. Another novel method, the prostatic urethral lift, UroLift, involves inserting implants to pull prostate tissue from the urethra, hence increasing urine flow without tissue removal. These methods represent advancements in BPH treatment, focused on minimizing recovery time while efficiently treating symptoms. In completing our journey through navigating prostate health after 60, we've covered the fundamentals of maintaining a healthy prostate, addressed typical concerns, and explored the various treatment choices available. From the significance of regular screenings to the advantages of lifestyle changes and developments in both drug and surgical procedures, we've covered essential topics to help you stay informed and proactive in maintaining prostate health. Remember, the key to a healthier tomorrow begins with the actions you take today. Dealing with urinary difficulties can be difficult and unpleasant. Watch our deep video on managing urinary issues to learn about practical relief and control options. From lifestyle adjustments to pharmacological procedures, we have it all. Check out the link in the description to begin improving your quality of life. Subscribe to the channel if you want to watch more videos on prostate health.